Silakan.
Mbak Sylvia mungkin nanti bisa langsung dimulai aja disapa lalu diserahkan ke Mbak Tatat untuk memberikan pembukaan. Terima kasih.
Good afternoon, everyone, and good morning to some of you. Let me introduce myself. My name is Sylvia Yazid. I'm going to be the moderator for this session. And to start the session today, I'm going to give the camera to Ibu Tatat from INFID. Ibu Tatat?
Yeah, thank you very much. So I will talk in English. Yeah, so first of all, I would like to greet all of you. I would like to greet all of you for participating in this discussion in this afternoon. Maybe some of you are still in the very early morning, like in the Netherlands or in other parts of the world. So I would like to say very warm welcome from Indonesia to the 7th Human Rights Festival 2020, which unfortunately we have to head it online. My name is Tatat. I'm from INFID. In INFID, I'm as a program manager, which currently, unfortunately, Pak Sugeng, our executive director, cannot join us. And then I also wish you us all to be healthy during this pandemic time, as this is a very hard time for all of us, which still, for example, in Indonesia, the number of the COVID-19 cases is still very much increasing. We don't reach the peak yet until now, so it is quite a hard time for all of us. And then also I would like to thank the moderator and all the resource persons this afternoon, especially Mr. Rion Mokhyun, the Director General of Democracy and Human Rights and Peace Bureau of Gwangju, and then also Ms. Amanda Fletty from the UCLG CISDP. And then there's also Mas Yanu Prasetyo, researcher from LIPI, and then the last one is Mr. Rud Maij, the philosopher or the lecturer of public policy, organizational development, and ethics at University of Humanistic Studies in Utrecht. And then the last is I also want to thank the moderator, Ms. Sylvia Yazid, for guiding us in this afternoon discussion. So what are we going to do this afternoon is to discuss, especially to get to know deeper the situation and then also the challenges and actions that have been taken in our respective districts or cities to deal with the pandemic. And then also, if the implementation of the Human Rights City framework contributes to more effective COVID-19 response. So I wouldn't talk too long, then I will just I wish us all to have a very meaningful dialogue this afternoon, and also as well as a hope that experiences of human rights cities from other countries in dealing with the pandemic can inspire us to contribute more and to build back better after the pandemic. Thank you very much, and good afternoon.
Thank you very much, Ibu Tatat. Yeah, let's begin this session. I would like to let you know that I'm hosting this session from Bandung, West Java, Indonesia. I just would like to emphasize that to again highlight how we are gathering here from all over the world with all different time setting. But yeah, we are here for human rights. So welcome to the session, Best Practices in Building Human Rights Cities During the COVID-19 Pandemic, Learning from Other Countries. Ladies and gentlemen, in some countries, policies made and implemented in response to the pandemic have been suspiciously anticipated and viewed as being harmful to the promotion of human rights. And I remember the video that we watched through the internet, where there were some residents from a certain country who were locked in their homes for the reasons of safety and guarded by police. And there were already comments of how this action, this policy was against human rights. And since then, countries and cities all over the world have been struggling to find the balance between priorities, whether it is going to be health, economy, or other forms of rights. And we are still in search for the balance. And today we are going to learn from the experience and best practices of others. And people say that it's the best way to learn is to listen to what people have done and improve and continue develop from that. We have 4 speakers to help us in doing that today. They are from different regions, and I can guarantee you that they are going to bring in interesting points of view. And for now, we will start with Gwangju, a city where I would say that it has been the champion of human rights city so far. Whenever we talk about human rights city, we have to mention Gwangju. When a city has been able to define what a human rights city is, for us academics, that's already an achievement. And to do that, I would like to welcome Mr. Yoon Mo-kyun. I hope I pronounced your name correct, sir. Mr. Yoon has his PhD in public administration from Chonam National University, and currently he is the Director General of Democracy and Human Rights and Peace Bureau of Gwangju Metropolitan City. He is the right person, the best person to talk about how Gwangju has responded to the COVID-19 pandemic while sustaining the provision of human rights. Mr. Yoon, the camera is yours.
안녕하십니까. 대한민국 광주광역시 민주인권평화국장 윤목천입니다. 아시아의 대표 인권 행사로 상징하고 있는 인도네시아 인권축제에 참여하게 된 것을 매우 뜻깊게 생각합니다. 인도네시아의 많은 도시, 단체들은 광주 세계인권도시 포럼을 계기로 우리 시와 긴밀한 교류를 이어오고 있습니다. 또 올해 10월에 열렸던 세계 인권도시 포럼에서는 코로나 때문에 대면하지는 못했지만 이렇게 화상으로라도 뵙게 되어 대단히 반갑습니다. 저는 오늘 광주시의 인권 기반 코로나19 대응 전략에 대해 말씀드리고자 합니다. 코로나19 발생 현황입니다. 먼저 우리 대한민국의 코로나19 발생 현황을 보면 12월 17일 기준으로 총 4만 6천여 명이 확진 판결을 받았고요. 600여 명이 사망하였습니다. 현재 매일 1000명 정도 신규 확진자가 발생하고 있습니다. 광주시는 지역 감염 639명이 확진되었고 이 중 3명이 사망하였습니다. 대한민국 전체 확진자의 1.8%에 해당합니다. 매일 10명 이내의 신규 확진자가 지속적으로 발생 중에 있습니다. 코로나19로 인한 도시들의 사회 취약성 및 인권 문제가 대두되고 있습니다. 지금 세계는 코로나19 대확산으로 많은 도시들은 방역 물품과 의료 인력, 병실 등이 부족하여 의료 체계가 붕괴될 위험에 처해 있습니다. 그리고 경제, 교육, 문화 등 사회 전반에까지 위기가 확산되고 있습니다. 그동안 드러나지 않았던 도시들의 취약한 부분이 코로나19를 계기로 나타나고 있습니다. 이러한 어려움 속에 인권 문제도 사회 곳곳에서 발생하고 있습니다. 시민들의 건강권을 지키기 위한 철저한 방역 활동이 역설적으로 시민의 자유와 경제문화적 권리 등을 제약하기도 합니다. 한편 대한민국 정부는 코로나19가 급격히 확산되자 확진자의 동선을 공개하고 방문 시설에 대해 일정 기간 영업 중지와 방역 소독 등의 조치를 취했습니다. 그리고 확진자와 접촉한 사람들은 2주간 자가 격리 조치하고 모든 해외 입국자도 2주간의 격리가 이루어졌습니다. 이로 인해 사생활 공개 등에 따른 인권 침해와 영업 중지에 따른 경제권 제한, 자가 격리로 인한 자유권 제한 등 많은 기본권 제한에 대한 이의 제기도 있었습니다. 그러나 대한민국 정부는 국민들의 건강과 국가의 안정을 위해 신속하고 철저한 방역을 실시하였고 코로나19 확진자 동선 공개 가이드라인을 만들어 인권 보호에도 최선을 다했습니다. 그리고 경제적으로 어려움에 처한 전 국민이 기본적인 삶을 유지할 수 있도록 재난지원금을 신속하게 지급하는 등 후속 조치도 이루어졌습니다. 5.18 광주 정신으로 코로나19 위기 대처와 인권보호 역량 강화에 대해서 말씀드리겠습니다. 중앙정부의 노력과 함께 광주시는 민주, 인권, 평화의 의미를 담는 5.18 광주 정신으로 코로나19에 체계적으로 대응하고 있습니다. 첫째, 민주적이고 투명한 대응입니다. 광주시는 공무원으로 구성한 재난안전대책본부와 지역 의료기관, 단체가 참여하는 민관 공동대책위원회를 출범시켰습니다. 모든 정보를 공유하고 코로나19 대책을 함께 논의하여 합리적으로 결정하고 있습니다. 그리고 감염 검사를 신속하게 실시하고 감염자의 통제와 이동 동선을 시민에게 즉시 공개하여 추가 감염의 위험을 최소화하고 있습니다. 또 해외 입국자에 대해서는 2주간 생활치료센터에 격리를 실시하고 자가격리자 안전보호 앱을 통해 24시간 모니터링하고 있습니다. 물론 인권보호를 위해 확진자를 특정할 수 있는 정보는 공개하지 않고 있습니다. 둘째로 소외계층에 대한 인권적 대응입니다. 사회경제적으로 취약한 사람들이 재난의 고통을 훨씬 더 크게 겪고 있습니다. 광주시는 9차례에 걸쳐서 코로나19 피해 지원 대책을 세워서 시행하고 있습니다. 저소득층, 특수고용직, 실직자 등에게 긴급 생계비를 지원하고 있습니다. 소상공인 및 중소기업에 대해서는 무이자 또는 낮은 금리로 경영자금을 빌려주고 있으며 대중교통 및 상하수도 요금 등 총 9개의 공공요금을 동결하였습니다. 또 문화예술인, 실직자, 고등학생과 대학생 등에게 맞춤형 긴급 재난지원금을 지급하였습니다. 외국인 근로자 등 취약계층에게는 마스크를 제공함으로써 감염병을 극복하면서 안정된 삶을 살아갈 수 있도록 지원하고 있습니다. 물론 시민사회에서는 수십억 원에 달하는 기부금을 모아서 소외계층에 지원하였고 건물주들은 소상공인들의 임대주를 낮춰주는 이른바 착한 임대인 운동을 펼치고 있습니다. 격리자 및 일반 시민들의 불안, 우울, 스트레스 등 심리적 문제를 해결하기 위해 코로나19 심리지원단을 운영 중이며 완치자에게는 신체 정신적 후유증을 치유하기 위해서 코로나19 온라인 후유증 극복센터도 운영하고 있습니다. 셋째로 나눔과 연대의 대응입니다. 저희 광주시와 조금의 거리로 멀리 떨어진 대구시 두 광역자치단체는 2009년에 서로 달빛 동맹을 맺었습니다. 광주는 코로나19로 큰 위기를 맞는 대구에 제일 먼저 광주의 병실과 의료진을 제공해 병상연대라는 새로운 지역 공동체 협력 모델을 만들었습니다. 최근 광주의 확진자가 급증할 때는 반대로 대구에서 간호사 10명을 파견해와 의료 지원 활동을 펼쳤습니다. 광주시는 국내 병상 응대는 물론 이웃나라인 중국의 9개 자매 우호도시와도 방역 구호 물품을 상호 지원하였습니다. 최근에는 광주시 긴급의료지원단을 모집하였는데 시민 150여 명이 자발적으로 신청하였고 다른 도시에도 30여 명이나 지원했습니다. 또 5.18 민주화운동 당시 시민들에게 주먹밥을 제공했던 광주 어머니들이 이번에는 의료진들을 위해 주먹밥 도시락을 만들어 주셨습니다. 이처럼 광주에는 수많은 연대의 손길이 이어지고 있습니다. 포스트 코로나 시대의 광주시 공공정책 변화입니다. 광주시는 코로나19 대응과 더불어 포스트 코로나 시대에 보다 포용적이고 회복력 있는 인권도시를 지향하기 위한 3가지 전략을 추진하고 있습니다. 첫째로 신종 감염병 대비 공공보건의료 인프라를 구축해 나갈 것입니다. 광주 공공의료원을 오는 2024년에 개원하여 음압병상 40개와 일반병상 210개를 확보하고 광주 주변 지역 주민들까지 진료받을 수 있는 호남권역 감염병 전문병원도 2023년에 개원할 것입니다. 두 번째로 2045년까지 탄소 중립 에너지 자립 도시를 만들어 갈 것입니다. 코로나19 대유행을 계기로 감염병이 기후변화와 밀접하게 관련되어 있다는 것이 밝혀졌고 기후위기가 시민의 건강과 생명을 위협에 올 것입니다. 이러한 미래 위험에 대응하기 위해서 광주시는 전력 부분을 100% 신재생 에너지로 전환하여 시민 모두가 녹색 에너지를 생산하고 이용하는 녹색 전환 도시를 만들어 갈 것입니다. 그리고 3천만 그루의 나무 심기와 도시공원 조성, 생활 폐기물 100% 자원화 등을 통해 기후 안심 도시를 실현해 나갈 것입니다. 또한 청정공기 산업과 환경융합 산업을 육성하고 기후환경 일자리를 창출해 나갈 것입니다. 이 모든 사업은 100여 개 시민사회단체와 기업, 행정기관 등이 두루 참여해 이루어질 것입니다. 셋째로 인권도시 네트워크를 더욱 강화해 나갈 것입니다. 2011년 세계 인권도시 포럼이 시작된 이후 인권연대를 향한 노력이 활발해졌지만 상대적으로 인권연대를 통해 함께 해결해야 될 인권과제도 많아졌습니다. 인류가 직면한 다양한 위기를 극복하고 지속가능한 인권 공동체를 만들기 위해서는 보다 강고한 실천적인 인권연대가 필요합니다. 광주시는 인권 관련 국제기구와 인권도시를 지향하는 지방정부, NGO 등과 함께 인권연대를 실행해 나가는데 최선을 다할 것입니다. 광주시는 10여 년 동안 인권도시 운동을 지속적으로 펼쳐왔고 그 경험이 쌓여 사회 전반적으로 포용적이며 인권 친화적인 문화를 형성해 나가고 있습니다. 오늘 회의에 참석하신 많은 도시 관계자분들과 끈끈한 인권연대를 구축해 나감으로써 지금의 어려운 시기를 함께 헤쳐나가기를 희망합니다. 감사합니다.
Thank you very much, Mr. Yun. Really appreciate it. I really appreciate how you highlighted the 3 key features of human rights city: democratic and transparent response, attention to the underprivileged, and also doing everything with the spirit of sharing and solidarity. And also, I would like to highlight how you have been consistent in promoting the human rights city, and also you were able to project the current condition to more long-term policies in the future in response to what have been faced at current condition. Thank you very much, Mr. Yoon. Ladies and gentlemen, if you would like to address a question to Mr. Yoon, you can always type your questions, and I will read the question to the panelists later after all the panelists have presented. Now, from Korea, we are going to see what happened in the other parts of the world. And to present us with that, we are going to listen to Ms. Amanda Fletty-Martinez from United Cities and Local Governments. And Ms. Amanda, who is now the Executive Coordinator of UCLG's Committee on Social Inclusion, Participatory Democracy and Human Rights, have been working with local governments in addressing various issues faced by the local governments. And of course, she would be the right person to share with us what have been happening, what initiatives have been made by cities around the world. Ms. Amanda, the camera is yours.
Thank you very much, Sylvia, and thank you, Infit, for the invitation today. So I will share my screen with my presentation. Share. Can you see it? Yes, perfect. I will just. So just to start, so UCLG, United Cities and Local Government, is a global network of local government, and we aim at gathering the voices of the local level, and especially highlight the experience from the cities and from the local government. And in this moment of pandemic, it has been a meaningful spaces to exchange on concrete experiences, concrete practices, but led by local governments who were at the forefront of the crisis and the pandemic, and finding solution, also sharing challenges. And during all the past 6 months, I would say, we have been really trying to hear this experience from our constituency on the way to respond to the crisis. The Committee on Social Inclusion, Participatory Democracy and Human Rights I'm coordinating is a special committee within UCLG gathering the human rights cities, and the cities committed to the right to the city. And we have been able to also highlight the experience of the human rights cities during this pandemic. So I will just start my presentation now. So human rights cities, which refers to responses to the pandemic. We heard Mr. Yoon Mo-Keon from Gwangju, and greetings from Barcelona to the city of Gwangju, which is a co-president of our committee. He started his speech with the numbers of cases, no? And I put one of the first human rights, important human right to respect, what the right to information and transparency from local government to their citizenship. I think it is very important to see how local government have been trying to be transparent on the number of cases, on the number, on the reality of the progress of the pandemic in their own city, and it has been an instrumental tool to be able to provide this data at the local level, and also not maybe to scare the citizenship, but really try to co-create local responses with civil society on how the pandemic was progressing. So I put two examples. I thought it was interesting to share here. The city of Vienna made an online platform translated into more than 24 languages, which respond to the need to have the same level of information for all the citizenship, because the city of Vienna is hosting a lot of migrants, and they decided to have all the digital accessibility for the citizen in their website. I also shared the example of the platform Decidim in Barcelona, which is a platform where citizens were able to share their ideas, share their initiatives, share their information they had about the COVID-19, also create some alerts of, for example, neighborhoods suffering more from social isolation during the pandemic. And they have been really trying to use these digital tools to better communicate with the citizenship, but also to enhance solidarity at the local level and enhance this right to information and transparency during the pandemic. The second right I put is the non-discrimination one, and the special attention to group in risk of vulnerability. This actually, a lot of local governments have been very responsive in targeting the group in risk of vulnerability. We also hear the experience of Gwangju in the previous presentation. I also shared here the experience of Mexico or SFAX, they have been really trying to gather all this reliable data on the groups who are not usually identified by the municipality, and really trying to go beyond that the groups they used to be in touch with. And for example, the city of Sfax, they literally organized a direct contact with the migrants and organizing phone calls to provide them with the needs they might have, and really providing them food and attention to respect their access to basic services during the pandemic and the lockdown measures. I also shared the importance of the digital divide, and I put the example of the city of Grigny and Montreal in Canada. They have been distributing laptops during lockdown measures. That's a very important issue also that we have seen during the lockdown, because there was a huge difference between the inhabitants who were able to have access to digital tools and the other ones who are not in capacity to connect because they didn't have smartphones or laptops. That was a very important challenges in terms of continuity of delivery of public services, and these are some actions led by local government, really to trying to better connect with the most isolated groups. I would also say that we have seen some existing threats and some existing inequalities being more important and growing during the pandemic. I took here the example of the right to housing. We had a lot of discussion with a lot of different human rights cities and local governments on how to ensure the right to adequate housing during the pandemic. It came on solutions coming from emergency shelter, respecting social distance for homeless people. The city of Montevideo, they really tried to provide hotel rooms and specific spaces dedicated to homeless people, where they didn't have to share like kind of a same space. They could have personal access to sanitation, personal access to water, and respect the social distance needed to fight the spread of the pandemic. Also in the right to housing, we heard a lot of experiences from cities who have been protecting the rights of their inhabitants, providing financial help to pay rents and mortgages fees, for example, because of the loss of income during the pandemic and the lockdown measures. There was also the suspension of eviction from the regional government of Victoria, Australia. We heard a lot of cities, for example, in Spain here, we had a movement of different cities also claiming the necessity to protect the citizens from evictions and the necessity to provide specific help for rent and mortgage fees. The second also important challenge that we heard a lot during this pandemic was how to protect women and children from domestic violence. It has been a huge human rights challenge, and we saw a lot of increasing of these domestic violence everywhere in the world. And this is a very interesting topic to see how, for example, the cities who have been able to put in place policies before the pandemic were more able to respond to the growing challenge of domestic violence during the pandemic. The example of Bogota is very interesting to see how all the channels they implemented before the pandemic were instrumental tools to respond to women violence during the pandemic, and they have been straightened. For example, they did this attention 24 hours per day to women. The city of Valencia also developed a local campaign to encourage the reporting of domestic violence during the pandemic. And we have seen this local government really trying to respond to this challenge of domestic violence against women and children. I would like also to share with you this. I think it's very important to highlight also how local government have been going beyond their natural competences and trying to develop new skills to adapt themselves to the challenges. And among them, I put some example regarding food security, right to health, enhanced citizens' participation and support solidarity dynamics at the local level. We have seen how this pandemic has changed a lot the relationship with the citizenship, and a lot of local governments really trying to organize door-to-door response in some more isolated neighborhoods. But also, for example, regarding the right to health, we know that health is not a common competences of local government, but we also have seen that the one who took some leadership in the way to respond to the crisis, to respond to the organization of local health responses, have been really able to ensure a better response for their citizens and control on the pandemic. I shared with you here the municipal health centers of Nanterre in France. They have been, for example, since day one, very paying attention to the relationship in the neighborhoods, providing concrete medical information on the pandemic, on the barrier gestures, with a lot of local response regarding the health issue. I also share with you the public drugstores of Renca in Chile, where there are specific places where they provide cheap medication for all, and they were also like close places to respond to the question of the inhabitants. Finally, I would also like to share with you. I'm just trying to change the slide. It's not working. Sorry. Okay. So from all this experience we have been gathering, we have been able to publish UCLG Decalogue for the post-COVID era, an opportunity to take responsibility towards future generation. I will share the link with you in the chat. I will invite you to check this document where we have been able to gather a lot of different experiences. You can also go on the website of Cities for Global Health. It's an initiative led by different networks of local government, not only UCLG, where any local government can inform and share what they have been doing and the practices they have been doing during the COVID-19. You could also find a lot of information about different cities across the world on what they have been doing. And finally, also, I wanted to share with you that starting next year, we have a process of revision of UCLG Charter Agenda on Human Rights in the City, where we will also take into consideration all this experience gathered during the pandemic and how human rights cities have been able to respond with policies and initiatives and action led by right-based action. And I would like to invite you to be part of this process that we'll be leading. And finally, to conclude, maybe some personal reflections. First, on the importance that the choice made by the local governments. I mean, we have seen how human rights cities, because they made the choices of having human rights policies before the pandemic, were more able to respond to the crisis and to the needs of their citizens, because they were aware about the necessity of the right to information, of non-discrimination in their policy, to get more attention to more vulnerable groups. And this dimension of human rights at the local level is meaningful at the time to respond to the challenges that we are facing now, the emergency of the social agenda, the emergency also of the economic agenda, and how to build a balance between these different solutions. The second point I would like also to share with you is I think it's important to ask ourselves how these short responses can be turned into mid and long-term responses, and not only be emergency solutions, but build strong policies supporting vulnerable groups, but supporting also human rights for all in the city. And the last point that we're seeing a lot is this huge preoccupation on how to face the growing inequalities that are coming from the pandemic, and that are major threats to the respect of human rights at the local level. And we are seeing like there is currently a lot of local government trying to make an international call on how to build a renewed social agenda and provide assistance to all the citizens regarding food, regarding health, regarding access to economy, and all of access to housing and non-discrimination. So I would just conclude here. Thank you very much. And I put some contact information also if you would like to contact me. Thank you very much.
Thank you, Amanda. And thank you, of course, to highlight how we need to reconsider priorities when we need to be more creative in responding to current situation, and how policies should be responding to instances like this. We need a stronger policy, but flexible enough to respond to any instances. I think one of the point that this situation have brought to our attention is how resilience should be also translated into being able to respond to any possibilities. Thank you very much, Amanda. And ladies and gentlemen, from region or location wise, we'll switch to issues. And one of the most important issue that come after the health concerns was economy. And to bring that issue to us, we have Mr. Yanu Prasetyo. He is affiliated with Indonesian Institute of Science in Indonesia. However, he is now doing his PhD study in the University of Missouri, Columbia. And Mr. Yanu is going to talk about universal basic income as a response to the COVID-19 pandemic. Mr. Yanu, the camera is yours.
Thank you so much, Mbak Sylvia Yazid, for the opportunity, and greetings to you all. And I'm so happy to be here. I'm Yanu Prasetyo. I'm a researcher at LIPI, and I'm presenting this from Columbia, Missouri, in the United States. So, as we mentioned before, that we're trying to find the balancing between economic problem and health problem. That's always kind of dilemma for the government and even from the public itself. So I'm using this term like a universal basic income because we are also talking about universal human rights. So I think that's really highly connected between universal basic income and universal human rights. But practically, I always use this as an unconditional basic income. So just for this discussion, we may be easier for us to use the universal basic income terminology than using another similar name. So the idea with this UBI is after the COVID-19 hit all across the world, many larger cities, especially like with the huge population, also have a really difficult time to, implement social distancing or lockdown without giving any social or economic security to their inhabitants. So that's kind of calling for some activists and academia and some researcher with the idea of protecting people from the lockdown or from the social distancing policies, that if you stay at home, working from home, or you cannot go to the market to earn money or do some jobs, then somebody needs to protect your income. That's why this idea is really interesting and it's growing and get more attention, especially in the US after the presidential election, that's in the national stage debates, that people talk about giving free money for every citizen, every American, and also in the Europe and everywhere in the world. So that's why it's very relevant today if you talk about UBI and human rights and how the government handling COVID pandemic all across the world. So as I mentioned from Mr. Yoon McKeown, like in Gwangju, that we also have a principle from Gwangju itself about human rights. And the center of human rights city is in the individual itself, like how we encourage individual to claim their rights, understand their rights, and also participate in the decision that affect them. Especially when the government want to make a decision about social distancing, physical distancing, or lockdown, this kind of decision will be affect directly to individual and the household and the entire community in the cities. So it is really important to hear the voice of the people itself when the government decided to implement such policies in their countries or in their cities. So using the human rights cities framework, then we can understand that the public need to be participate or actively engage with the government decision that affected them directly. So the idea of universal basic income then will be some kind of not only balancing those needs in the economic side and health from the government side, but also like will be some potential from the permanent solution for some very long problem like homelessness, like poverty in the cities, urbanization of poverty. Those all kind of problem can be also solved by the universal basic income implementation. As we know, after the pandemic, more and more people will be fall into below the poverty line, and more people will be difficult to meet their ends to get some relevant jobs to them or to get more income to survive during pandemic era. Even in the post-pandemic, we're still not sure what's going to happen in the 2021. Even though there is a vaccine right now, but still there is also another challenge that most cities in the world will facing, like the growing of the precarious work, and then the automation, how artificial intelligence will replace many manual physical jobs by humans. So that's kind of a complex problem that all the large cities and all this dense population will facing in the future. So this momentum of the crisis in the pandemic is also an opportunity for government or city leaders to find some solution like unconditional basic income, so they can also use these policies not only protecting people from the harm of COVID-19, but also protecting people from the long term. So if you connected the Gwangju principle of human rights and basic income, actually this really fits with 6 principle in the Gwangju principle, which is non-discrimination, because we talk about universal basic income, so everyone receive a payment from the government, so there is no one left behind. And social inclusion, of course, so there is a lot of issue about racism, about minority, about people, vulnerable groups that always left behind from whatever decision from the city leaders. So this kind of unconditional basic income ideas will also make more inclusive policies to the cities and to inhabitants. also is social justice, solidarity. That's all will be encouraged by the universal or unconditional basic income policies. And like in developing countries problem, we have a huge problem with corruption and all inefficiencies in the policies, targeted policies. So the UBI is also really what to try to handle or to tackling problem of the corruption or inefficiencies in targeted policies for the poverty alleviation. So the gaining support from UBI is worldwide. It's not only in the US, as you see from after the president election or during this COVID-19 pandemic, but also all across Europe. There's a survey with more than 12,000 respondents conducted in the March when the COVID-19 is started hits many cities. And what you see here, like 70% of Europeans believe that states should give all citizens a basic income. And it's all across the ages, not only from the adult or young, but respondent in 16-year-olds to 29 is also 70% support the idea of giving all citizens basic income. And this is quite interesting. If since in I think like 3 or 4 years ago in Switzerland, there is a rejection by the parliament there that UBI is not really needed or is not really relevant for that country. But after the pandemic, now I think they may change their opinion about the importance of basic income. And also in Australia, the gaining support from the public and citizen is also growing, that 58% of Australians support the UBI. And it's also because of the lockdowns, like we talked about before, like, yeah, if you stay at home and there is no income, so somebody need to protect your livelihood and your income. So UBI will be a really important alternative for solving this problem. And what we already know with the UBI is it is a guaranteed floor for everyone, a regular payment, and it's always in cash, not in kind. And it's for individual, there is no string attached, and universal for everyone. However, this universality is not really there right now. So we have like a 4 type of basic income: a full basic income, which is the ideal type of basic income for everyone and universal. And then a resource-based dividends, like in the Alaska, when the oil-based funding for basic income, and then a partial basic income. This is what's really common in many cities and many countries where the government protect for the particular groups of recipients, like maybe for some specific workers or some specific groups. And then a supplemental basic incomes for those who are working in social protection or social security policies. There is also debate between replacing the old welfare system with the new UBI or something like that, where we want to make a supplemental policies to protect the income of the citizen. And what we are about to find out is some experiment in some cities. Some of them using UBI as a platform to combat poverty and systemic racism. Most of them in the US. And some of them talk about the experimenting with regional currency, like in Gyeonggi province in South Korea, and Mereka in Brazil. In Mereka, they use a regional currency as well, but also use value-based funding. And in Vancouver, Canada, they use this experiment to solve the homelessness problem, like giving a lump sum, one payment in the front to the homeless, and then compared to other groups that didn't receive the basic income, and the result is already out there. You can reach the report of the Vancouver experiment, and some scientific evidence that need to be seen is also in Germany right now. Well, the private funding trying to do some experiment in Germany with giving 120 people a basic income in Germany. So this is a very long game, and we need to invest more of financial capital and also policies speaking, like how every single government or every single stakeholder in the cities can talk and sit together, like what happened in the US after the presidential election. That's a lot of people supporting basic income. There is like 24 plus mayors all across the states that make a coalition supporting UBI ideas. For example, in Stockton, California, they already started since 2019, and they give 125 of their residents like $500 per month as a basic income. So they got funding from the Silicon Valley, from Twitter, and from those people who can see in the future that the jobs in the future and the work and our habit in the future will be changed due to of technology and AI. So this collaboration between private companies like Twitter or Silicon Valley companies with mayors all across the state will be interesting to see what's going to happen in the future with the idea of universal basic income. And we will see some of them already have a plan, like in Minnesota, St. Paul, and Compton, California, but some others still working on that plan. And this is what I'm talking in the Vancouver, that they're using basic income scheme for the homeless there and giving them like $5,600, just one time payment, and then it's really improved the living of the homeless in Vancouver. In South Korea, it's really interesting. They give a basic income for youth, for the 20 years old of citizen. Maybe Mr. Yoon McKeon is also familiar with this experiment in Gyeonggi. So yeah, I think this is also a very creative or very interesting alternative for cities, that if you want to protect your inhabitants, especially in their economic side, so unconditional basic income with some kind of improvement or modification will be interesting to implement. And also similar in Brazil, they have a card that preloaded by money from the government, and they give them like $33 per month, so they can spend this, but only in the city of Mereka. Similar with the Gyeonggi, this only can spend in the Gyeonggi. And there is a report from Gyeonggi how this scheme helping small businesses growing, because after the pandemic, as maybe more than 50% of the customer is gone, even more. And then after launching the experiment of basic income, then the spending, the consumption of the citizen and resident is also increased dramatically. And this is the last part of my presentation, two of the last part. So this is from Stanford Basic Income Lab, that if your city or some city leaders want to implement unconditional basic income, there is some step that we can follow, from starting with choosing the name and the aim of the pilots, like do you want a full basic income or just supplemental basic income, and then who's your population target. It's better to try to reach out as much as possible, but if the fiscal space or the funding is not really enough, then you need to be more creative how to reach out all those group in our community. So, and the frequency and the duration of the on the experiment or on the policies, and how these 5 stakeholders need to sit together and talk that what is the best for the participation. Like we talk in the human rights, the most important things is how we involve our inhabitants to talk together, like what is the best for them in this difficult time. So basic income can generate inclusive prosperity, because once you involve everyone in the cities, there will be profitable business for everyone, not only for a specific group. And it's also will protect many rights for people, right to work, right to say no for the dangerous work, right to say no for abuse relationship, and for women itself, it's many unpaid work will be appreciated by the basic income approach. So I think this is a really promising idea, as we see that it's growing everywhere in the world. So I think I will just stop there and we can discuss, and I will give back the time to Mbak Sylvia. Thank you so much.
Thank you, Mas Yanu. Yeah, I think we could agree that basic income is a kind of popular choice for countries to handle this economic issue brought by the pandemic. However, thank you for highlighting that priority has to be made because it's different for each country, and it is also the method of distribution, who to give and how to give it are also different. And when we have priorities and we make choices, of course, logic is involved, rationals are involved, but also we need to involve moral values. And to deliver that, to put highlights on that, I would like to invite Mr. Ruud May from the Netherlands to share the experience of focusing on the moral aspects of policies in the Netherlands. Mr. Ruud May is currently teaching at the University of Humanistic Studies, Utrecht, and he is the partner of Governance and Integrity International and director of the Foundation for Justice, Integrity, and Anti-Corruption. He is now working on a moral research and consulting project with hospitals, elderly care, youth care, and youth protection, those who we consider as those with vulnerabilities. So, Mr. May, the camera is yours.
Thank you very much. Thank you very much for inviting me in this I would say exciting meeting. COVID has been for all of us, I think, worldwide. I think we are now all in code orange, so to say. A quite devastating experience, I would say, but it has also brought us together in somehow. And this is one of these examples that I'm talking now from Alkmaar, a small city north of Amsterdam, to you in Jakarta and to all other participants worldwide. And I think we wouldn't have imagined that it would be so easy about a year ago. So we are learning now on an immensely pace, not only about vaccines, but also about all these different experiences worldwide with COVID and coming up with answers for very, very complicated questions. So thank you again for inviting. I want to tell you something about the project Sylvia just introduced, and I'll start up my my presentation, so to say. And this is about, I call it citizens as victim and factors, because we are in such a difficult relationship with COVID, in this COVID, because we are not only and could not only be victims of getting contaminated by COVID, but we are also spreaders of COVID, so to say. And that makes, I think, moral rights, human rights is something what's deeply connected to our personal life and our personal choices, so to say. I want to talk to you about a project we started almost when we were in the Netherlands at the first lockdown in March, and that was a project on creating a community of moral inquiry with hospitals, elderly homes, youth care, youth protection, about what professionals experienced as the most difficult, complicated questions they were facing. And we choose professionals, care professionals, because we had the idea that all these difficult moral decisions were somehow at the crossroads in decisions professionals in these organizations and institutions had to make. Second, one of the things we wanted to do is that we thought it would be very important to connect all these experience in the Netherlands. As you probably know, the Netherlands is a big city, so to say. And so my university is in Utrecht. Utrecht is a human rights city, but if you look a bit at the Netherlands, it's all very close together, so to say. So we thought bringing these experiences together in a common learning process would be of real value for not only for professionals, but also for public policy, for public health, and not the least of citizens who are dependent on the healthcare and so on. So, but let me take you very fast to some typically Dutch issues, so to say. So, well, I don't have to tell you about human rights and health and right to a healthy life, but I'm talking to you about one of the most affluent societies in the world. So we are now talking about pandemic policy and human rights policy, so to say, from a country of the Netherlands in an affluent society. And as I'm not only working in the Netherlands, but working worldwide, there is a big difference if you are living in such a privileged society as ours, and you are living in let's say, a society which doesn't have the advantage of being such a wealthy and affluent society. So one thing is, when it comes to healthcare rights, we have these in our constitution since 1983. And one last remark on this. So that is that we shouldn't underestimate that we are in this endemic condition. No one underestimates it, I think, so to say, but it really puts us out of normality. It puts us in a state of emergency, especially in a state of moral emergency, I would say, but not also, as Janu just explained, it's also about economic emergency. Every answer we came up to when we are in normality somehow fails when you are in a pandemic condition. And especially also counts when it comes to, I would say, the right to a decent health care. So, of course, you have the right, but this right is immensely under pressure because of this pandemic condition. So let me tell you a short things about the Netherlands. So according to World Value Survey of Ronald Engelhardt, so we are in the Netherlands, let's say, a postmodern nation, a postmodern society. That means that we are not only very wealthy and liberties are very well expanded. We have a very critical civil society with very critical citizens about their government. But there's something added what's very specific for this type of societies. And you see them in the northeastern part of this picture, so to say. And that is that this pursuit of happiness has become so immensely important for my fellow citizens, so to say. And that means that you, in the words of what Engelhardt calls, you are in for I would say, non-material values are so immensely important. So Christmas, for instance, has become a very different thing for me and my fellow citizens now than for my parents and their parents, I would say 50, 60 years ago. Then it was a religious, let's say, a religious event. And today it's an event of happiness, of spending, of being with your family, not only with your family, but also eating and so on. So this is what this happiness does. And to give you one of examples, so this is also from this World Value Survey, is that when asked what are main resources of value for people worldwide, you see these little red bullets at the outer circle of this, and the answer to it is family. And you see this, and the yellow bullets are the most important. The value resources are religion. And there's only one that's blue or purple, as you would like to say, and it's the Netherlands, and these are friends. So that's an indicator that our traditional resources of moral values basically shifted from traditional community to friends, so to say. And my students will recognize this immediately. So this is about a bit about the Netherlands and how I would say public health issues and the answer to COVID in the Netherlands has its special peculiarities, I would say. First of all, I already said that we are in this pandemic condition, and that means that every human right is under pressure, I would say. It's not only because our government takes values. We are now in the second lockdown since last Wednesday, and we have about we had about 650,000 people contaminated in the last months. Yesterday only there were added 12,000. More than 10,000 people died. So we are still on the wrong side of the page, so to say, when it comes to COVID. And my government has chosen for the first lockdown, what we had basically in February, that goes in for what they call an intelligent lockdown. And what's an intelligent lockdown? That you trust people, you trust citizens to make choices for themselves, so to say. So you try to respect individual liberties and individual economic activity as far as possible, and you say, okay, you're gonna find out, and for yourself, and take your own decisions and make your own, let's say, weighing of arguments, so to say. And what we can say already, that strategy failed. So we are not that intelligent when it comes to making such decisions, and there are a lot to do with what I just sketched. This pursuit of freedom, wealth, and happiness, so to say. So if you make an appeal to common sense, as our Prime Minister Mark Rutte did a lot of times, you get disappointed because the common sense basically points you in another direction. Like you have to enhance your freedom, economic activity, and happiness, and it doesn't make it's very complicated to limit that, so to say. So and in that sense, it was a very I was stuck in a very, let's say, I think I found rather special, so to say. Well, when we talk about human rights and we talk about societies and nations, we often think about policies implemented by governments, so to say. But in these COVID circumstances, we have, let's say, policies implemented by citizens against each other. To give you a kind of an anecdotic evidence, we didn't have a mask wearing obligation until the 1st of December. And I was in my city in Alkmaar when I did go to the supermarket, and I did that in March or April. I was the only one protecting a mask, so to say, until November. So that's the Netherlands. And then you see this neoliberal intelligent lockdown fails, so to say. And so I can do that to myself. So to summarize this, our vulnerability grows. We have an obligation. That is why reason to protect to wearing masks. I have to protect vulnerable people in my city, in the supermarket, and it is a human rights obligation. But it also we are also pressed to think. We are also entering unknown territory, especially when it comes to moral issues. And we have to think about this how to answer that, and then what we have to enter we have to come up with a kind of an art of invention. And like when it comes to inventing a vaccine, also in moral terms, we have to outlearn the virus. So the virus doesn't stop to us, but we can stop hurting each other in that sort of sense. So that comes me to the second part, and that's the moral archive corona. So what we start doing is creating an infrastructure already starting in March or May to connect hospitals, to connect healthcare professionals working in hospitals, youth care professionals, elderly homes, and so on, to ask them to share with us and their most difficult decisions during Corona time. And we suppose that these decisions had to do with decent, good work. They had to do with the respecting rights of citizens, all these kinds of things. And what we wanted to do is in the Netherlands to connect these experience of not only professionals, they are basically the starting point, but also the organizations they are working, citizens in the end, and regions to make a collective learning about these moral issues possible. We also thought about what is the goal of that. Of course, we want to support people who are working there with some sensible advice, so to say. But one of the things is also that Corona is deeply devastating for people who work with patients, but also for citizens. So, and we want to come up to with a kind of idea of creating centra or environments of justice, mourning, healing, and forgiving. There are making a lot of just decisions made in the hospitals and the elderly homes, but there's a lot of, let's say, harm created also there. Not because people are doing the wrong things, but because doing the right things has such an immense cost, so to say, for others. So I will skip this one. We're doing that, so this kind of research for some time now. So, and I'm working with about 20 years about this issue. And I think with me and my colleagues, I think we investigated so these kind of difficult decisions, I think in the last 20 years, about 10,000, and we worked with about 100,000 participants in a variety of institutions, and not only in the Netherlands, but also in USA, Ukraine, Caribbean, Russia, Bangladesh, and so on. So I think we have a bit of a methodology that could work in very different cultural environments, so to say. And I would say it is justice-based. I love to explain something about that later, but for the moment it would take us simply too much time.
Yes, and Mr. May, could I remind you that you have 5 more minutes?
Okay, that's okay.
Sorry about that.
No, you're quite right. We're doing that. So let me take you a bit to the discoveries we made. So the first, and it's no surprise, of course, that that you could say what the differences between the normal conditions in hospitals, elderly homes, youth care, and so on, is that it immensely increases the moral costs. So what you have to make a decision if you're working in a hospital, of course, then these are not of course often these decisions are difficult, but if you have to decide if children are allowed to attend their dying parents, and you have then to deny them the right because of the risk of contamination, so to say, then you can see or even feel that these moral costs began to increase. That is something that you would normally never do in the Netherlands when someone is dying in a hospital, so to say. And so this is what actually increases. These most moral, tragic decisions, moral costs, so to say. It also puts pressure, I would say, on. It adds, I would say, suffering to people, what you normally wouldn't do, and it increases moral stress, moral injury, and moral trauma in hospitals, in youth care protection, and in elderly homes, so to say. And second, what you could easily see that while you probably know these principles of biomedical ethics, they are quite I would say general, and to keep them as a starting point, that when it comes to not harming people, doing well, respecting autonomy, attentive care, and social justice and distribution, these principles are immensely under stress during Corona. So the risk of violating, and I consider these principles as a kind of translation of this human right of healthcare, is actually one of the most challenging parts, I would say, about what we experience in the hospitals and so on, so to say. So I put some quotes from interviews in the left column, so to say, and they really say this, show this, that I'm working below my normal professional standards. People are dying with their family, and I would never have allowed them doing that. We have called it access morality in elderly homes, but we can see that not everyone who died in elderly homes should have died in elderly homes. So, and we also see that we have created a kind of social suffering, and social suffering is suffering by design. So we didn't have to have enough protection materials in the beginning. And that put healthcare professionals in immense predicaments to make choices how to work there, and made them also often by design violating safety rights of their patients, but they feel stuck in that. So I'm almost finished now. So I think this is still under construction, just so we decide to go on with this project until COVID stops, basically, so to say. And I think our main focus has been on professionals, interviewing them and connecting them with governments, and they are now trying to make steps to other fields, cities, regions, but especially also reaching out to citizens. One of the most important discussions now for citizens is, should I take the vaccine or not? I'm very curious if we succeed in creating this as a kind of national moral inquiry instead of a discussion where everybody has an opinion and doesn't bring us together, that our project will help them too. So I'm a bit, I think, at the end. So thank you for listening, and I hope that adds something to our, I would say, our thinking about this pandemic state of emergency.
Absolutely, Mr. May. And this is a topic that we have been putting aside for a while during the pandemic, because everyone has been reacting according to whatever they think is important at present. And I really like the idea that I think this can be expanded to all aspects of life, not only workplace. And I'm just curious how this study would apply in Indonesia, where we have so many variations of backgrounds, interests, cultural backgrounds, economic background. Thank you very much for pointing this out to us. Okay, so we have a list of questions already, and I would like to read it to you. Let me just check the... yes, the first question that I would like to highlight is, from Zulfikar Muhammad. How do human rights see if there are people who refuse vaccination by the government? I think this is something that we are anticipating in Indonesia, because the vaccination is already in the country, and it's planned to be administered early next year. And I guess the reasoning could be different, but we would like to know, maybe from various countries, how this is anticipated. I would like to ask Mr. Yun first. Is there any tendency to refuse vaccination in Korea? If there is, even if there is a small group refusing, what has been done to turn that situation?
그건 안녕하세요, 윤목현입니다. 물론 있을 수 있겠죠. 한두 사람, 아주 극소수라고 보는데요. 그러면 사회적 합의, 주변에 많은 사람들, 또 그 사람이 또 다른 코로나를 유행시킬 수 있으니 또 주변 사람들이 권유하고, 그것이 이 사회적 합의로 이끌어져서 결국은 권유해가지고 그 지역에 더 이상 코로나라고 하는 전염병이 퍼지지 않도록 설득하고 합의하는 과정이 중요하다고 생각합니다. 그렇게 되면 아무래도 충분히 설득할 수 있다. 또 그 정도 우리 국민들이 역량이 있다, 이렇게 생각을 하고 있습니다.
Thank you, Mr. Yun. I've been listening to the Indonesian translation, and you mentioned about social agreement. Is that right? Or social consent? Could you elaborate on that?
물론 예, 어떤 정책이든지 전 국민이 일사불란하게 그걸 수용하고 따르지는 않을 것입니다. 자기 의견하고 안 맞아서 반대할 수도 있겠죠. 그러나 이 미중류의 코로나19 상황은 그것하고 좀 다릅니다. 저 개인의 생각하고는 다르다고 생각해서 이 사회 전체를 생각해야 된다. 내가 백신을 거부해서 내가 확진자가 되고 또 나로 인해서 내 가족과 내 주변과 내 직장과 많은 사람들이 또 다른 확진자가 되고 그래서 그 지역사회가 이 방역 체계가 무너지는 그런 현상을 누가 바라겠습니까? 그런 정도는 저희들 국민들은 충분히 사회적 합의에 따라서 수용 가능하다 이렇게 생각이 들어집니다.
Okay, thank you very much, Mr. Yoon. And I assume that this is where Mr. May can come in with the moral values. Would you like to comment on that? I think you're still muted, sir.
Yes, I'm again. So thank you. Well, you're right. I think in the Netherlands, about 65% of citizens want to take the vaccine, and 35% are really hesitating about it. And so there's basically one thing when it comes to these human rights is very important. So in the sense that taking a vaccine and taking it not only voluntarily, but that you are obligated to do that, violates some principles, social rights, because it is an interference with your body, of course. So, but I would say that basically two things. So for me, if I want to, I'm discussing with my colleagues and people who don't agree with me. What struck me that people who don't want to take the vaccines are not crazy. So they have some really concerns about that. So I think, so I would take the vaccine tomorrow, but if they don't want to take it, they have really concern about what will happen in the long term and whatever, so to say. So, what I think one of the most important things is that what the pandemic teaches is one thing that, okay, I think protecting the vulnerable comes first. So if you have to weigh and taking that, protecting the vulnerable comes first, because they can't protect themselves. That's simply what it is. And we have to keep the healthcare available for everyone. But what I see when it comes to a discussion about, well, do I take or don't I take the vaccine, that's often a very hot public discussion, so to say. And I would very much love that to change that in a more like considerate discussion, that we can do justice to all our arguments, because they are there. Also, all the people who are worried about it, they are there, so to say. So it's a price of our democracy. It's about the price of human rights, that people have the right to refuse, even if you don't agree with it. But you have to investigate it. It is not a given, accepted as a given thing. And Dutch policy was basically also thinking about, well, could we introduce a policy that people who don't take the vaccine have no entrance to public buildings like libraries or something like that. So to say, that's also a point of a discussion. I'm not sure if that is very wise, but okay, I can imagine that.
Yeah, and that makes it relevant to the next question from Zulfikar, is that how do we balance between the strategy of economic recovery, especially for small scale economic activities, or the traditional market in Indonesia, for example, who are in real need of economic activities. They need to be actively participating in economy. However, they are also not implementing all the protocols. Who should I? Is there anyone who would like to respond to that? The balancing. Sure. Mas Yanu.
Yeah, thank you. Just a quick response from the first question about the uh, vaccination. I think like I want to point out on the role of disinformation. So we will have the similar problem to every single issues in this era where people is divided, polarized in two different views in totally different world because of disinformation through the news, internet, and other information sources. So it's also happening in the face masks in the US. When we did our survey on the March, it's only 40% of residents in 4 states, in Missouri, Illinois, and Arkansas, and Kansas, that following the protocols. It's just because of the disinformation, and some people call it like fake news and every, like, so we need to increase the literacy of the general public, and also the responsibility for the news industry, the media, the journalism, and all these people should work together to fight with the disinformation, because it's caused like polarization in every single issues in all across the world. So, and secondly, second question about how we like protect small scale like small scale economic activities, but keep protecting health aspect of the people. So yeah, I think that's also interesting question that not really solved by any like sure answer for that. But I just want to say, if uh, we give people like a guaranteed income or guaranteed their flour, like for like just a temporary, like UNDP recommendation, giving people like temporary basic income, that will give us time to learn how people react when this policy is like strictly implemented, and then on the other hand, they will give you some protection in your income. Because we never really tried that policies in reality, because some of the issue is always like the ideologically based debates, like in the face mask. There's another problem, like people, if you wearing a mask, then you are more like liberal people, but those who don't is more conservative. And we need to educate people. This is not about your political affiliation or your ideological part, but I agree with Professor Ruth, like it's about saving lives. Like if we do this protocol, that we're saving many lives of people surrounding us. So I think those messages need to be repeat and repeat again. So the disinformation need to be addressed more seriously in the future. I think that's my quick response.
Thank you, Marciano. I will come back to you for the next question, but first I would like to ask Amanda's opinion. Have you come across a case in any country that UCLG is are working on with when they have to deal with these traditional markets practitioners who are important, who are an important part of the economy, but they are also not practicing with the protocols? And how have they dealt with this kind of dilemma?
Thank you. I will also answer to the first question, actually, regarding the vaccine, maybe contributing a little bit from a local government perspective, because in Europe, there is many countries, and especially France, where you are having a lot of people asking questions about the vaccine, and maybe quite, I would say, not really ready to get the vaccine, and a lot of local government have been trying to open the discussion and the debate with citizenship, because there was also at some point the fear that some pharmaceutical lobbies could make money about the vaccine, and there is a huge debate on that also, and it should be taken into consideration. And a group of mayors, they launched a call to ask if the vaccine formulation could be public, actually, and not to be like having a public molecule for the vaccine, so it could ensure that we are talking about health as a right and not as a commodity. and there was this launch of these mayors calling for this to have governments ensuring that it is a public medicine, a public vaccination, and not a private lobbies who are dealing with the administration of the vaccine. I think it's very important debate, and not an easy debate, and maybe we will face more opposition that we think we will face actually. Regarding the second question on the balance of economic recovery and how to mitigate a little bit the impact, we have seen different initiatives to support local economic development, and especially regarding the marketplaces. First of all, we have seen a rank of measures, for example, trying to control the number of people accessing to the marketplace instead of closing them, also to arrange time schedule for vulnerable groups, for example, elderly people who could have like a specific access, a priority access in specific time, so they don't have to cross too many people. We have also seen across the world other initiatives that, for example, local government really trying to develop digital markets for local and small business places. Actually, we heard 2 days ago the experience of Semarang in Indonesia, where they have been doing this kind of activity also. Now we're trying to gather a group of local business and make like 1 week sale off on a digital market about handmade products and everything. So yes, there is a lot of different solutions that have been explored. Also, there is all the challenges of renewing the mobility, I would say, for example, with all the delivery tools. A lot of companies of delivery have been adapting their solutions, so small business could also have access to these tools and deliver to local citizens.
Okay, thank you very much, Amanda. Yes, for the next question, I'll go back to Masianu. Masianu, there's a question regarding the UBI. It's from Pak Tafrihan from Wonosobo. Hello, Pak Tafrihan. Nice to see you again. Can it be implemented in Indonesia? And how do we count it? How do I think what he meant was how do we calculate the allocation of the UBI? Masianu?
Yeah, sure. That's a really great question. Thank you for the questions. And also, I mean, like, I want to put the position of Indonesia compared to other countries about the visibility of UBI or basic income or unconditional basic income. So actually, we already have some study focusing on the modeling of basic income in Indonesia, economic modeling, and also some idea or even debate between proponent or opponent of basic income. 2 days ago, I just invited by Bappenas to talk about UBI, and there is a team in Bappenas that also talking and studying the potential of unemployment benefit, job guarantee, and universal basic income. So the government right now is exploring many possibilities and many scenario to implement some kind of social safety net and social protection for Indonesia. So I believe that we will keep, follow this development from the government. But from our side, that we propose on basic income, we believe that we can implement that. I mean, from many scenarios, like from small scale scenario, like starting from villages and then from the cities, from the province, or even national. So we can start this experiment from small scale, and then we scale up to the bigger national level. So that's the best way to implement, because we need more research and we need more evidence from the field how this cash transfer affect the behavior of people or the economic itself. Even though many governments still believe on GDP, like as a measure of the economic situation. Like if you put basic income in national level, that's also will grow your GDPs. Like the last report from Canada, even in Indonesia, we also projecting there will be 35% people will alleviate from the poverty line. So those kind of experiments still needed right now, but if the city leaders want to protect, they can absolutely do the unconditional basic income starting from their local areas. And related to the small scale enterprise as well, or micro, like UMKM, micro small scale enterprise that really hit bad by the COVID-19. So when you subsidize in production side, like corporation, that's no promise that there will be, the money will be, you know, like running to the economy. But if you give subsidize to the consumption side, we know that 57% of Indonesian GDP is from the household consumption. So that will be help if you believe in GDP, but we are not really agree with that. But if you believe on that and that measurement, so basic income is also helping to grow the GDP and we recovery back quickly. So that's the argumentation from proponent of basic income. Thank you.
Yeah, I think that we'll need a further study for that, right, Ms. Yanu? Because I remember even when the crisis in 2008 or 2009, each country has different approach to that. I remember Indonesia created this working, like low-paid working setting, while in Australia, I was in Australia at that time, they just automatically transfer some amount of money, but to the woman of the household, because they believe that when the woman receive the money, they will use it for the family, but when the man receive the money, they will save it. But
right,
yeah,
right.
I don't know whether it's true or not, but that is an assumption like that. Amanda, it seems that you would like to say something. No, okay. Okay. I would like to ask a question to all the panelists. This is something that I personally observe and experience in my country, in my city. I would say my city. Bandung is a city where people love to hang out. People love to go to cafes, chat with friends, and I think it's the characteristic of most of the cities that you are in. And it seems that the alertness is going down lately. I don't know whether it's because they are numb to the urgency already, or I don't know. But it seems that people are more relaxed with this protocol and everything. So I would like to ask the panelists, how do your cities maintain the alertness, the urgency of maintaining the protocol, because people would like to have their normal life back, and they want it soon. So how is it maintained? We know that COVID might not be gone soon. I would like to start with Mr. Yoon, maybe.
그 경계심이 낮아지고 그런 건 뭐 어디나 있겠죠. 지금 비상 상황인데도 불구하고 그 여러 사람들이, 특히 젊은이들이 술집에 모여서 맥주를 마신다든가, 그래서 대유행으로 그게 번지고 그런 경향이 있습니다. 그래서 지금은 이제 국가나 지방자치단체에서도 강제하기 이전에 많이 권고하고 또 캠페인을 벌여서 소규모의 만남도 자제하고 집에 가서 이 코로나 바이러스를 극복하자. 그러면서 이제 서로 만나고 싶은데 못 만난 사람들, 서로 SNS나 전화로 안부 묻고 서로 좀 상황이 좋아지면, 코로나 팬데믹이 물러나면 우리 서로 만나자, 이렇게 그 서로 편지도 쓰고 또 광주시에서는 그런 영상을 제작해서 상대에게 보내도 주고 라고 하는 그런 것도 있습니다. 옛날에는 한국에 이런 속담이 있었어요. 만나면 우리가 이제 좋아지고 성공하고 흩어지면 죽는다고 그랬는데 요새는 이제 반대로 만나면 죽고 집에 가만히 있으면 산다. 이렇게 우스갯속담도 있고 그렇습니다. 이런 걸 막 캠페인으로 전개하고 해서 그런 게 많이 좋아지고 있습니다. 고맙습니다.
Yeah, I guess we are quite similar. We do have the similar proverb. Okay, Amanda.
So here in Europe, so I live in Barcelona actually, but most of the countries, a lot of different countries, they had like a second phase of lockdown measures or curfew also during nighttime to really avoid having too many gathering. There was also restaurants and bars who are now closed in a lot of different cities. So that's more, I would say, national government measures, not that much cities one. In Barcelona here, they have been controlling a lot the mobility of people within the different neighborhoods of Barcelona, and also from the outside of the region, and impeaching people to travel that much. So here, yeah, the response is pretty tough to control the second wave and avoid having too much cases. But actually, there is like a rising of the number of cases, and especially here in Catalonia in Spain.
Okay, thank you for that, Amanda. Thank you for sharing that. Mr. May.
Yes, I recognize what you just said about people coming together again and be more relaxed with measures, so to say. I think one of the things, a lot of things are already said about. I want to add something about young people. So we're really, if I look at my students, most of the students are about 20 years, 25, and they're just developing their lives, so to say, getting to know who they are. Exploring their identity, so to say, and we are asking actually a great sacrifice from them. So that we are asking them to sacrifice one of the most exciting parts of their lives by not meeting each other, so to say. And I really feel sorry for them. So every time we meet a lot like this, of course, and I feel myself like a sort of caretaker for them, to make it a bit very personal, so to say. And of course we have in general we have the same problem, and one of the things what basically worried me a lot about the last months in the Netherlands, that cities became super spreaders, so to say. It's really the cities who are basically the source of spreading the virus in a lot of ways, and that is what I wanted to put in my small contribution, like the citizens as a factor, as a victim. And so you also as a citizen, you are in the position to violate rights of others. So it asks so much about, so to say, especially of young people. So but I want to let's help the young people to connect, so to say, because it's the elderly people, and the young people are basically paying the price in sense of happiness and so on. So I feel very sorry for the young ones. So help the young ones, so to say. But of course, I very much agree with your proverb. So to say.
Yeah, I agree with you, sir, because my kids are getting closer to each other. I mean, I'm happy to see that. However, I'm quite worried about the social skill now. Because they're so used to each other and they're not interested in going out anymore, and they are in their golden ages. Thank you very much for that. And Masiano, how is America?
Yeah, yeah. I think like human is social animal, social creatures. It's impossible to lock them up for like forever. So, but there is also the role of leadership. Like I noticed there is a huge problem in our leadership in many countries, including Indonesia, even the U.S. Like you cannot say to people like to stay at home, to follow the protocols when the leader itself didn't give an example. So I think the leadership is also need to be evaluated and criticized, because many of them just in different world. Like if people is struggling, people is facing difficulties time, and they have no choices like what people in the elite classes and ruling classes. But yeah, if the leadership can show the more like empathy and more discipline as what we expect from the people, I think that will be a better response from the public. But when the leader says that there is no problem to gathering outside and there is no problem not wearing mask, so don't expect much from the public. They just follow what they see, and yeah, I think we cannot blame to the general public, but we need to show more stronger leadership and solidarity, and give some example that this is the right things to do, or that's the bad things to do. Yep.
Yeah, I guess if I may be a little bit religious about that, all religions teaching usually say examples are stronger than words. So yeah, thank you for reminding us that. Okay, I think we have a little more time left. I would like to get comments from all the speakers. When we are talking about the pandemic, there have been, as I stated at the beginning, there have been concerns that addressing the health issues might sacrifice the human rights, the provision of human rights. I would like your closing statements on that argument, or on other points that you would like to make. Could I give the first chance to Mr. Yun?
네, 그동안 수고하셨습니다. 인도네시아는 인권도시 가이드라인을 수립 시행하고 인권 축제를 매년 개최하는 등 범국가적으로 인권도시 운동에 심혈을 기울이고 있는 것으로 알고 있습니다. 그만큼 많은 인도네시아 관계자들께서 광주가 개최하는 세계 인권도시 포럼에도 많이 참여해주고 계십니다. 여기에는 인피드가 큰 역할을 해주었습니다. 그리고 인도네시아의 인권활동가 펫조 운퉁 선생은 올해 광주 인권상을 수상하였는데 인도네시아 활동가로는 5번째입니다. 벌써. 이처럼 인도네시아와 많은 도시와 활동가들은 광주시와 끈끈한 인권 연대를 맺고 있습니다. 앞으로도 이런 관계가 지속되고 더 많은 교류가 있기를 희망합니다. 다시 한번 이런 소중한 행사에 초청해 주셔서 대단히 감사합니다. Thank you.
Thank you, sir. Amanda?
Thank you very much. I hope that we will really continue the human rights movement and showcasing how a right-based approach in policies can be a meaningful way to respond to the current challenges that we are facing. We know we need to have this cross-cutting approach. No, it will not be enough to only address economic issues, to only address social issues. We need to have like this integrated approach on how to develop concrete responses from the local level, and hopefully human rights will guide this new action, because we need some creativity. We need to renew the social contract at the local level to respond to all these challenges. and human rights can be for sure a way to build more inclusive cities for the future. Thank you very much.
Thank you, Amanda. Appreciate it. Marciano.
Yeah, I think that's a really difficult question, but I'm trying to emphasize on the importance of knowledge and information. Even though we're living in the information era, digital era, 4.0 era, whatever people call this abundance of information, but the huge problem in the general public is about knowledge itself. It's kind of a paradox. We have information out there everywhere, but then the correct information or the right knowledge is really hard to get for the people. So if we talk about human rights, we talk about a balancing economic health, the priorities of the city. So it's actually about the knowledge that we get some asymmetric information between the agent or between the actors in the human network. So once we can build more better knowledge and eliminate those disinformation, I think we can communicate better about which one is the priority for the human rights, because it's not like win and lose game or like we need to find a win-win solution, because when you play the zero-sum game, there will be some people under unfortunate situation. So yeah, let's start from building more better knowledge by eliminate more disinformation and give more example, and then dialogue, participation, and don't look down to the people or the public, but hear their voices and listen to them, because it's human. So if you can pressure human to some kind of policy that not really fit with the natural our natural need. So yeah, I think a fight against disinformation and make a better knowledge and dialogue participation is the key for better future. Yeah, thank you.
Thank you, Marciano. That would be our homework. Mr. May.
Thank you. Of course, the human rights, basically, I would say, is stressed by the pandemic, so to say. So there is a lot of stress on difficult human rights, because human rights is not something very specific, but a container, and the heart of the container is respecting human dignity, so to say. And we try to translate that in policies and so on. And respecting human dignity, that's always possible, even in a pandemic situation. So I think that's one of the things that I learned from our project, that is one of the most important things to create these kind of environments that make it possible to do justice to others and respect human rights. But it has become more problematic, and the choices you're making are very much more difficult choices, as I said, with more higher costs, so to say. It makes us all much more aware that human rights are not given, even in the Netherlands, when it comes to healthcare rights, because we are this rich and affluent society, and healthcare is normally available for everyone. And now we have to say no to people who need healthcare, and we can't provide them with the healthcare we normally would give them, so to say. So in that sense, I would say it makes us even more aware that it's not to take human rights as given, but to take an obligation. Then when we harm others by the pandemic, the least people have the right to is a decent justification and a transparent justification why we do this or that. So what I learned a lot of that. So also this conference, which I think it's very, very important in this thing. It teaches me, like our last discussion, that even if we can't meet physically, we can get connected, and this being able to be connected, this improved immensely. So in the last 9 months, so to say. So, and that's what I put my hope of. If we can keep connected and can have these kind of discussions, I think this 21st century will be the era of an unexpected increase of practices of human rights.
Thank you, Mr. May. And yeah, we adjust, we develop a lot during this time, this hard time, this difficult time. And one of the adjustment that I've made in my classes is to use word cloud with my students, and that's what I'm going to use now. So during the session, I've been taking notes, and these are the words that I jot down: democratic and transparent responses, underprivilege, sharing, solidarity, information, non-discrimination, vulnerability, rights-based responses, participation, values, moral, persuasion, inclusivity, leadership. That's important. And the last one is connected. I hope that we can stay connected, everyone. Thank you very much for a great session, and stay safe, stay healthy, and a popular saying, stay negative from COVID. Thank you very much. I hope you have a good weekend. Thank you, everyone.
Thank you.
Thank you very much.
Hi, committee. Would you like a photo session with all the panelists?
Okay. I will help with the screenshot, maybe. For all the panelists, if you want to join the photo session, please turn on your videos. Hello?
I think we are all on.
Okay. I think my internet connection is not stable.
I'll do that.
Mas Warno? Okay, thank you.
Okay, 1, 2, 3. Yep. Terima kasih. Thank you very much. Kamsahamnida.
Terima kasih.
Will it be danke for Netherlands?
Okay.
It's just getting lighter. The sun's coming up. Have a nice Christmas, you all.
You too. You too. Bye.
You too. Bye.
Thank you. Have a nice day.